Hello, welcome to today's first ever Vasculitis Women's Conference. I'm Joyce Kullman, and I'm the Executive Director of the Vasculitis Foundation. Thank you for joining us today. It is wonderful to have so many participants ready to connect and learn from our incredible speakers and from each other. Our goal for today is to develop a greater understanding of how vasculitis impacts women in all aspects of life and to build upon the collective strength of our community through education and connection with other patients living with vasculitis. This conference was recorded live on June 12, 2021. We have edited the 5 sessions into individual webinars and encourage you to watch all of them as you have time. Each session is unique and all of the speakers share important knowledge and expertise. My co-host for today's conference is Kaylin Young, the Director of Development and Communications with the Vasculitis Foundation. Kaylin has her master's degree in social justice and human rights, specializing in qualitative research methodologies. She served as the Director of Research Affairs for the Vasculitis Patient-Powered Research Network, our VPPRN, for the 7 years prior to May 2021. Kaylin has dedicated her career to patient engagement in clinical research and has a deep passion for elevating the patient voice in research design, implementation, and development. Also joining us today on the conference and working in the background is Ed Becker, our VF media producer. Ed produces the VF Road to Wellness webinar series and the Vasculitis Visionary podcast, featuring conversations with medical specialists from around the world. He also serves as co-producer on a new podcast series, the ACR VF Guidelines, which will be launched later this summer. And we want to especially thank our sponsors, Amgen, Genentech, and GSK, for their support of our 2021 Patient Virtual Conference Series. Thank you. The title of today's session is Dream Team, Dynamics with Assertiveness Training to Create a Strong Care Team, and our speaker is Dr. Jenn Gordon. Dr. Gordon holds a PhD in pathology and spent nearly 30 years in academia, most recently as an associate professor and NIH-funded biomedical researcher, studying neurological disorders and infectious diseases at Temple University School of Medicine in Philadelphia. She is currently Vice President of Preclinical Development at Excision Biotherapeutics, a biotech startup developing CRISPR-based gene editing therapeutics for curing viral diseases. Since she was diagnosed with EGPA 7 years ago, she has become an active volunteer for the Vasculitis Foundation. She currently serves as a patient partner in the Vasculitis Patient-Powered Research Network and the VCRC VPPRN EGPA registry. She is committed to using her skills and knowledge for research and education toward improving the lives of people living with vasculitis. Dr. Gordon, thank you for being with us today.
What I want to talk to you today about is assertiveness in your dream team, your doctor's appointments, and how you go about your care. I'll just point out in terms of my disclosures that, as Joyce mentioned, I'm a patient partner with the VPPRN and the EGPA committee, and any of the compensation that I've received for these activities has been donated to the VF. So why am I talking to you today? So I'm not a clinician, and I'm not a therapist or a psychologist, but I know doctors. I know lots of doctors. As Joyce said, I spent nearly 30 years in academia at medical schools where I did research. And I work directly with doctors as colleagues. I train medical students and graduate students and residents. And then one day I got sick and I got this strange disease I'd never heard of, EGPA, a form of vasculitis. And I had to learn how to be a patient. So what I want to talk to you about today is some of my thoughts and ideas, and hopefully give you some things to think about as well, as we all learn to be better patients. So the first question I have for you to ask yourself is whether or not you think you are a good advocate for your health. Are you a good self-advocate? When you are advocating for your own health, I know many of us probably think we could do better at this. What about when you're advocating for someone else, for your kids or your loved ones? What would your loved ones say about your level of assertiveness? And are there any improvements that you want to make? And what might they be? And how can you do this? So I'd also like to mention that advocating for yourself is really, really hard, especially when you're sick. And I think most of us have been through that. So why is assertiveness particularly important for women and related to the talks that we're going to hear about today? And the first thing is, what many of us know, intrinsic factors about women. Women tend to be people pleasers and want to agree and tend to avoid confrontation. And this can affect our ability to be assertive. And then there are also societal factors. Women have a greater imbalance of power in healthcare settings, tend to be male-dominated profession. We know there's much literature, and our clinical colleagues know this very well, that symptoms of pain and fatigue and often the rare types of symptoms that are experienced by those of us looking for a diagnosis can often be dismissed in women. And as many of us know, assertiveness in men is considered acceptable, but assertiveness in women is often labeled as being aggressive. So that's a framework I think that's important to keep in mind. So the first step in your care is getting a diagnosis. And I know many of us have been through this scenario as well, thinking that the journey to the diagnosis is the hard part. And since we're all on the call today with vasculitis, I will assume that that we've all gotten diagnosis, or a vague diagnosis of vasculitis, or a specific diagnosis of a type of vasculitis. But actually, there's a lot more to it. And the journey really starts, again, once you've been diagnosed. I'm not going to talk about my diagnosis. I did a webinar a number of years ago for the VF, and you can find it on the library where I went through my journey. But just to highlight a few aspects, some of the parts of the diagnosis involve things that are measurable. If you talk about your organs, right? Asthma, you can do pulmonary function tests, blood work, for example, for detecting eosinophilia or ANCA, purpura, if you have any type of skin rash. But then there are lots of these other symptoms like the fatigue and headaches and pain that are very difficult to measure. So it's a challenge for us to be able to communicate these things with our doctors. But ultimately, once we have a diagnosis, then we set on the journey for the treatment. And many of us are familiar with the scenario. The typical treatment that you have for vasculitis will start with high-dose corticosteroids, possibly rituximab or Cytoxan in very severe cases. And then the docs start adding other drugs. And then hopefully they're able to taper down on the prednisone. So there are specific actions and then very specific goals for each of these actions. So the initial corticosteroid is to control the inflammation and minimize the damage. And then a stepwise approach to minimize all the toxicity from the medication. So why am I telling you about this? Because it's important to understand what the purpose of each part of each medication, each part of the treatment plan is. So this is my first 5 years of my treatment plan that I mapped out and kept track of every day and turned it into this graph because I'm a researcher, so I like to look at data. And in the red, you can see my prednisone dose. And in the black, you can see my flares. So I had a very difficult course in the first number of years. not typical for most patients, but many of us have been through the ups and downs, literally, of vasculitis, and many different treatments. So now I'm actually doing pretty well, and have not had a major flare in the last several years. But you can see that this sort of process can be very complex. And as it's very complex, it's going to involve a lot of different clinicians on the team. And then another thing that, of course, they don't really tell you is that it could really take a while for you to figure it all out. So while I might have had a very high expectations that once I had a diagnosis, now we're just going to get everything in line, sometimes reality is a little bit different from that. So the first step is to have a goal. You need to have a goal. What is the goal of your treatment? And I know my treatment goal is to get into remission. And this is probably a treatment goal for many of us. What exactly is remission? Well, remission, if you ask our clinicians, they would say it would be no evidence of disease activity. And this could mean that you're still on some medications, what we call pharmacological remission or chemical remission, or it could be a drug-free remission. And there's a lot of discussion by clinicians about, like, does remission really mean off of prednisone altogether or low levels of prednisone, et cetera? But step one, have a treatment goal. So I would ask all of you, do you know what is your treatment goal? Do you have a very specific goal? You should have one, and your clinician likely has one. So if you don't know what it is, it's a discussion you should have with your care team. So the goal here is supposed to be to set this the big goal of remission. And usually the big goals are the easy ones. And it's when you kind of drill down into the details that it can get to be more challenging. But in a broad strokes, vasculitis is walking that tightrope between minimizing the damage from the vasculitis versus minimizing the damage from all the drugs that they give you to try to control the immune system. So you have to find that right balance. So now, what do you do once you have the plan, right? You have a goal, now you have to set the plan. So what's the purpose of the treatment plan? The treatment plan is to meet the goal. So questions for you are, what is your treatment plan? Do you know what your treatment plan is? Do you know the role of every drug and what it's supposed to do? And how is that drug supposed to help you reach the goal? How will you know when you get to the goal? Will this be blood tests? We heard one question in the prior talk. What if my blood tests are always negative? Well, that's actually the case for me. My blood work is always normal, and it doesn't tell me whether I'm having a flare. Can you use imaging or other types of tests? What about quality of life measures? How well do you feel? And how are you going to measure that you're reaching your goal? There may be the ways that the clinicians want to measure how you reach your goal, and then other ways that you personally would like to use as the measurement for reaching your goal. So you really need to take some time and sit down and think about these things so that when you go and meet with your doctors, you can have a discussion with them. So I'm not going to talk about the basics, right? We all know you have a doctor's appointment, you've got 15 minutes, you've got to get everything done. There are all kinds of strategies. You can bring your lists and you can make sure you get your refills, et cetera. But what I really wanted to talk about today was more, these are actually more tactics. I wanted to talk more about the strategies, the bigger strategies, the things that are happening outside of the appointment and how you think about your approach to your care. So is this you? I know this is probably many of us. You go into the appointment, you sit down, the doctor says, how you doing? And you say, I'm okay. You say, I'm okay. Does that mean you're really okay? Or do you say, I'm okay, but you're not really okay? Or do you actually tell them, I'm not okay? So practice how you're going to have this discussion with your doctor when you get into the office. In the beginning, it might be that chit chat, how you doing? What's new? How's the weather, et cetera. But then after that minute or two, you have to settle down and get started because you only have the 15 minutes. Are you prepared to tell the doctor exactly how you're doing? Because otherwise, they might be looking at your labs, like in my case, all the labs are normal, but that doesn't tell them how I'm really doing. And are you being honest with yourself about how you're doing? Another tip I'll just mention is try not to talk while the doctor is typing or looking at their chart. This is a really, I thought, an interesting picture. This is a girl who drew this picture in the doctor's office, and you could see her mom and her brother and sister, and they're all kind of hanging out. And then way over here on the side is the doctor typing away, looking in the other direction at the computer. Another question, do you do this? This is the Columbo, right? You're in the doctor's appointment, your 15 minutes is now gone, you're reaching for the door handle, you're about to leave, and then you say, oh, just one more thing. Do you think it's important that blah, blah, blah happened to me, right? If you're coughing up blood, obviously that's front and center. First thing, how are you doing? Well, I have to tell you, I've been having blood in my sputum. Okay, that's going to change the whole conversation. So don't do this to your doctor, right? They think they're wrapping up and you're just getting started. Another thing, how you prepare for the appointment is going to tell your doctor a lot about the information that you're providing. So if you're clear and you're providing everything that the doctor needs to know and thinks that is important, they're not going to interrupt you. They're going to listen to you. They're going to let you get through your story. Typically, doctors might interrupt after only 12 seconds. So you can actually gauge how well you're doing at communicating by how well the doctor is listening to you. So how do you know if they're listening to you? Well, one way you can check is you can look in your electronic medical record and see whether or not there are any notes. So there's a movement called Open Notes, and you can Google Open Notes, and they've been opening up a lot of the doctor's notes. Doctors all write what they call progress notes to document your visit, and they write these for each other, but most importantly, they can't submit their bills to insurance without writing them. So there's definitely a progress note written for every encounter, as they call them. And you can look for this, usually it's under notes. It's not the visit summary, it's another section. But you can find more information about that. And you can go back and read and see, what did your doctor write down? Are they capturing the most important things that you said? Is the information correct? And that's how you'll know that they're really listening to you and writing down everything that you said. So I should say that if you feel like your doctor is not listening to you, you're probably right. And you should find another doctor, because it's going to be very difficult to get things done if the two of you are not communicating well. Okay, so I said the goal here is remission. So how do we get there? I've got my dream team, my clinicians and me. I'm the one doing all the work, right? I'm the one in there taking all the punches, taking all the hits. I've got to get up, do it again. I've got my rheumatologist. That's my head coach, as I call him. And then the other members of the team. And sometimes, these can go on and on and on. So you need to know, who is your head coach? Who's the one who's making those decisions? And then what is my role in the plan? I have to commit to the plan and the goal, and then I have to get in and execute the plan. So you can ask yourself, how are you doing on these things? Maybe you're committed to the goal and the plan. How well are you at executing the plan? Do you take notes? Do you report back? Do you make suggestions? Where can you improve in what you're doing? And I would just remind you that if you have a great care team and if you're working together on that goal, then you can do this kind of complicated change in your medication. This is one step at a time. This is a dose of prednisone every day over years and years, and changes in medication one at a time with great communication. And this would be the goal, right? That you're working together with your team to do this kind of thing. So I know I'm probably going to have more flares, but that's okay. I've got my team, and I know that they're going to be behind me. And I just remind everybody that patients know more than they think they do, and you are the expert. You are the expert of you, and nobody can tell you otherwise. And there are publications to back it up. The clinicians have studied this. some of our favorite clinicians here, they know that patients know they're having a flare before the doctor can see it in their blood work. Patients know when they come into the appointment that they're having a flare or that something is going on. So here's another one. Do you do this? You're in the doctor's office. The doctor wants you to do something and you say, yeah, and you have no intention of doing it. They want you to see a specialist, but you're not planning to schedule that. They want you to fill a prescription and you don't want to take that medication. They want you to go for a test, but you know you're not going to schedule that. And hopefully this is not happening. They want you to change your dose of prednisone, but you don't want to do it, right? Why do you agree in the office to do things that you're not committed to? Especially something like this, which can be very critical to your care. Your doctor thinks you're on a medication or getting a test that they think you need, but you're not going to do it. So this should be stuff that you discuss immediately in the office. This can be really hard to disagree or to question your doctor. So you can plan, practice. What are some of the things that you can say to your doctor? When all else fails, you can say, I don't know, I need to think about it. But practice saying, this is not working for me. I need to tell you something. This is not a priority for me. Can you explain that to me again? Practice saying that so that it comes naturally to you when you're in the appointment and you don't have to try to think of the words. Come up with your default, when they say, can you do this? What is your response going to be? The other thing is, do your doctors know what their job is? So I know my rheumatologist, as I said, is my head coach, and nothing happens unless my head coach agrees. And I make that clear to everybody else. If another doctor mentions prednisone, I say, got to check with my rheumatologist, right? Doctors want to do something. They want to give you a prescription. They want to give you a referral. Maybe you don't need that. My lung doc, for example, just knowing the doctor is there in case I have an infection and I need to bring them a sputum sample, that's all I really need. I don't need antibiotics. I don't need other referrals. I just need to know that they're there on standby for me just in case. And sometimes the doctor needs to hear that. Why not just tell them, it's really great that I can come and see you and I know you're there when I need you. And they understand that that's enough. And sometimes to send them a note saying everything's doing well so that every time they hear from you, it's not because there's a disaster. So if you want to get to your goal, what doctor is going to help you get there? And sometimes, people get conflicted about getting a second opinion, thinking that this might be cheating on your doctor. Well, I'm sure many of us have experienced with our vasculitis docs that they may recommend, hey, why don't you go and talk to somebody else? These guys work with each other. They know each other well. So you may be able to get in a second opinion. Sometimes the doctor wants you to get a second opinion. It's not cheating. We're all in this together. Another thing is to try to separate the message from the delivery. So if you're faced with a choice, would you rather have a super nice doctor who's not an expert in vasculitis or a super experienced doctor that is really difficult to work with? It depends, right? I mean, your PCP might be super nice and not have a lot of experience, your primary care doctor, but they're really taking care of you. They help diagnose you. They're committed to answering the questions and figuring things out. That's great. A world expert, you're going to see a surgeon. You go to see them once in a while. I know I really want the surgeon to be a great surgeon, not necessarily the nicest person in the world, because when you're on the operating table, I don't need them to be nice to me. No offense to any surgeons who might be listening. So it's good to think about, what do you want from your doctor and how are they helping you meet the goal? What do you want from your doctor? Do you want them to tell you everything is okay? Most of us know that we want them to respect us and listen to us and help us to decide what we should be doing. But sit down and figure out, what do you want and how are you communicating that clearly? What are the questions that you're asking the doctor? We had a lot of questions on the chat already. Why did this happen? What is the cause? Do we think something like this caused it? Unfortunately, right now, for vasculitis, most of the answers are we don't know. And knowing the cause right now does not affect the treatment plan. So while these are interesting questions and research questions, they're not going to tell you what medication to take and how to reach your goal of remission. So the more questions that are more valuable to ask the doctor are the why questions about treatment, about tests, about other options. And make sure you're asking the right doctor. You don't ask the electrician when the sink is clogged. So you need to know which member of the care team is responsible for what. Another thing you can do is sit down and try to predict before you're talking to the doctor. What do you think they're going to say? Do you think that they're going to agree you're having a flare? Do you think they're going to change your medication? And then sit back after the appointment and ask yourself if you guessed correctly. So then in terms of goal setting, I think this is really critical. What is the goal that you have for your treatment? Like I mentioned at the beginning, what is your plan? And what is the thing that you could do right now that would make the biggest impact? What is stopping you? What is stopping you from getting to that goal? Are you stuck? Do you have the resources you need? Do you have the team that you need? Most people that are successful are very clear on exactly what they want. And then I'll just end with, don't give up. There are always more options for treatment. And there are new ones coming every day. So please don't give up. And then knowledge for me has been critical, learning everything that I can. And I thank the Vasculitis Foundation for everything that they're doing to help educate patients and clinicians around the world. Thank you.
So Jenn, thank you so much for that presentation and all those great ideas and suggestions. I always feel like I learned something when I listen to one of your presentations. So thank you. So Kaylin, I'm going to turn it over to you to feed some questions to Jenn. So take it away.
Thank you. Actually, Jenn, I'm going to have a couple of attendees have had similar comments and questions, and I would like to allow them to actually ask you directly, but we've received several kind of comments in this same general topic. Let's do this. Sarah, you should be able to unmute yourself now.
Okay, thanks. You can hear me?
Yes, you sure can. Thank you.
Thanks. Thanks, Jenn, for sharing that. I actually watched your videos as soon as I was diagnosed. So it's nice to see your face here. I thought, oh, I know her. I mean, I don't, but anyway, it was inspirational when I got my EGPA diagnosis. So it's only been since February 4th that I was diagnosed. So I'm still trying to find my way through it. But one thing that you said that really struck me was, it's been so frustrating because I know what I felt like before. I mean, at least now I have a diagnosis. Last year was all about arguing with doctors that I didn't have COVID and that my asthma actually was different than it ever has been. And but you know, now they'll do blood tests or my pulmonary function test, you know, with my Nucala that I'm on, and my pulmonary function test looks great. But I still, you know, if I'm in a meeting for an hour, I'm short of breath by the time I'm done with that meeting. I'm so tired. I can't talk. I'm short of breath. And, you know, from a pulmonology perspective, I look wonderful. And I feel like I hear that, you know, the ENT I just saw, it's like, your sinuses look okay. I'm like, I sound like I have a perpetual cold. And I don't know how much I just need to accept it and know, like, this is what my life is now, and how, you know, maybe that is part of it, because I'm trying to figure that out too, since this is all really new, and how much of it is, no, this is not normal, and is there something I can do? So it really struck me when you said that, and I don't know how to sort that out.
Well, thank you, Sarah. I appreciate that. And I can tell you, first of all, welcome to the club that nobody wants to welcome you to, but we're glad that you're here, right? The Vasculitis Club and the EGPA Club. And it's early days. I think you need to be patient with yourself and give yourself some time. You know, many of us have been there. You can reach out to me directly. I'd be happy to talk to you. I would say that It takes a while to settle in, and it takes a long time for these meds to start working under the surface. And it can really be a long road, but there is a recovery, and there are things that you can do. In particular, I know I've been doing strength training, and that's helped my PFTs. I could not do that in the early years. I was just trying to get by. Every 5 minutes that would go by was like a success for me. So you need to be very patient and be good to yourself. But there definitely are things that you can do, and you'll figure them out. You just need to not give up.
Okay, thank you. And that's a good reminder that it's some of the things are underneath the surface that you can't see. Okay, thank you.
Thank you.
Great, thank you. Jenn, another question that came in was from Kathy, and she wanted to know, is there an application to graft the drugs with the symptoms like yours? Did you create that out of your research background, or?
I just did it in an Excel spreadsheet and created a graph, because I do that all the time. I know there are a lot of symptom tracker apps out there. I think it's a topic that might be useful to do a webinar on. I'm no expert in that, but I know there are others that do it. But symptom tracking, I think, we could do a whole day of symptom tracking in different domains. So I saw Kaylin's comment about other ideas, and that was an idea I have that I think that would be interesting. I think a lot of people would get value out of that.
Yeah, I agree. Marjorie asked, she had a question. She has EGPA and has spontaneous splenic bleed 4 years ago. And then she had a pain on her left side. It was mild. Tests didn't show anything. What do you do when tests don't show anything, but you still feel terrible? You know, she said, and she wrote, sometimes I'm just readying myself for the big flare and feel hopeless. Thanks, Jenn. I was needing this talk. There is no spleen doctor.
Yeah, well, usually when the tests are negative, I say that's good, because when the really bad things happen, they can find out what it is, right? So oftentimes when like there's something terrible, like your spleen is ruptured, right? They're going to figure that out. So at least this is not life-threatening, like in the short term, right? So that means that I'm open to try to figure it out myself, and to go and seek other opinions, and to keep asking questions and say, okay, if I'm not getting a response from this team of doctors, I need to find a different doctor who's going to listen to my concerns. I have to think outside the box. Or maybe I need to ask myself, are there any other signs that I could be having a flare? And it could be very subtle, but is it a side effect of a medication I may have started many months ago? Is there something we could do to try an experiment, stop a medication, change a medication, sit down with your coach, talk it through? If your coach is not listening, you need a different coach.
Great, thank you. Kaylin?
Great. So Vivian, I'm going to unmute you, so you should be able to pose your question.
Yes, I have chronic neurological Lyme. And yeah, where can I go to get a doctor to give me at least one shot of steroids or an IV steroid? He says it has to be done in the hospital. I think maybe just go to ER and show the report to the ER doctor and let him try an IV steroid drip in ER for me.
Well, I think you probably need to talk to a CNS vasculitis expert and find one of those, and also a Lyme disease expert, right? And you may have to go back and forth between them. Sometimes the diagnosis is not as clear, and you need to make sure that you've got a clinician who's going to advocate for you. So that gets back to having the right head coach. So you need to start with either a primary care physician that you trust, or see if you can find a vasculitis specialist or another CNS specialist that can help you. But don't give up. You need to go and try to find the answers to your questions.
Dr. Gordon, thank you for your wonderful presentation. It is such an important topic to our patients. And we want to especially thank our sponsors, Amgen, Genentech, and GSK, for their support of our 2021 Patient Virtual Conference Series. Thank you again for joining us today.